Assalamualaikum, this is Dr. SHAMAMA and today I'm here with a very important topic considering some very important points regarding differentiating different types of hernias. Okay, so starting with the first type of hernia, here we'll discuss briefly major important points. Like first hernia we'll discuss is difference between reducible hernia and irreducible hernia. First we'll discuss about reducible and irreducible hernia. Now reducible hernia is one which can easily be reduced back, like the contents can easily be reduced back into the abdomen, and irreducible is which cannot be reduced. Now differentiating both these important test is cuff impulse test. So if cuff impulse is positive, that is reducible hernia. If it is negative, that is irreducible hernia. Moving on to the second point, that is obstructed hernia and strangulated hernia. Now obstructed hernia, both hernias can be differentiated by one important point, that is the blood supply to the intestine or to the loop which is herniated. Fine. Now if the blood supply is compromised, that is strangulated hernia, and if the blood supply to the loop is intact, it is obstructed hernia. This is an important point to differentiate both of them. Then moving on to the third type, that is indirect inguinal hernia and direct inguinal hernia. Now both of these, I'll explain you the concepts later on after it, but both of these, they can be differentiated by the ring occlusion test. If the ring occlusion test is both these, they can be differentiated by ring occlusion test, direct and indirect inguinal hernia. Moving on to the fourth type, that is umbilical hernia and paraumbilical hernia. Now both these hernias, they are basically the swelling over the umbilicus, but umbilical hernia will be a smooth swelling, smooth circular swelling, and the shape of paraumbilical hernia will be crescent shaped. So this is a differentiating point between both of them. Moving on to our next hernia, that is femoral hernia and inguinal hernia. Now both of these, they are the swelling of the inguinal region, but the femoral hernia, that is located, this femoral hernia is located below the inguinal ligament, and inguinal hernia is located above and medial to the inguinal ligament. This is an important differentiating point. Then moving on to the further some ventral hernias. Now in ventral hernias, from where these ventral hernias originate, like where are the defects, what are the types of ventral hernias? We have umbilical and paraumbilical. Now if the contents, they are entering from the umbilicus, defect lies in umbilicus, that is umbilical or paraumbilical hernia. If they enter from linea alba, if they enter from the linea alba, then they are epigastric hernias. Same if it enters from the lateral border of rectus sheath, then they will be called Spigelian hernia. Okay, so these are basically the differences between these types of ventral hernias. And if there is any incision in abdomen and they are entering from that incision, that will be incisional hernia. So these are the differentiating points of some ventral hernias. Moving on to another important point, that how these hernias develop. Particularly we'll talk about direct inguinal hernia first, and then we'll talk about the indirect inguinal hernia. Now, direct inguinal hernia, to explain it in very easy concept, this is the anterior superior iliac spine, this is pubic symphysis, and here somewhere lies the inguinal canal. Now, this is supposed the posterior wall of the inguinal canal. Now, if any loop of intestine, it enters through directly. Now, direct is which uses a shorter route. I'll write here, it's an important point, which uses a shorter route. That's why we're calling it direct inguinal hernia. Now, if this loop of intestine from abdomen, it enters through any defect in the posterior wall, which is formed by transversalis fascia. So it enters from this posterior wall, it enters the inguinal canal. From there it moves on into the, okay, from this defect it enters the direct inguinal ring, and from there into the inguinal canal. From inguinal canal through superficial inguinal ring into the scrotum. So this is the route of direct inguinal hernia. Now we'll talk about the indirect inguinal hernia. Now, talking about this indirect inguinal hernia, now it will take a longer route. First of all, important point, it will take longer route. And now talking about what will be the route. Just a second, let me just set my video. Okay, so it will take longer route. And what is this longer route? That similarly from this inguinal canal, if the loop of intestine, it enters from a defect, or you can say persistent part of processus vaginalis. Now this processus vaginalis, I'll explain you its concept first. What is this processus vaginalis? What it is that in childhood, testis is present in abdomen. This testis move from abdomen into the scrotum and take some peritoneum along with it. Fine. Now this peritoneum, it forms a root, which we call, this root is formed now. So its proximal part that of this peritoneum, that is the processus vaginalis, it usually obliterates normally. But if this processus vaginalis do not obliterate, then there is a connection between this root from abdomen to the scrotum, from where later on the intestines can easily protrude. Fine. So if this loop of intestine protrudes through this defect in the persistent part of processus vaginalis, from there it enters processus vaginalis, and from there it moves into the inguinal triangle, from triangle to the deep inguinal ring, to inguinal canal, then to the superficial inguinal ring, and then to the scrotum. So takes this long route and then enters the scrotum. This will be indirect inguinal hernia. This is the major concept of the indirect inguinal hernia. Now moving on to another to some other hernias. We have another hernia. Now these are some MCQs point. There is a hernia called Richter's hernia. Fine. Now what happens in this Richter's hernia? This hernia is rich. In it, the sac, it contains loop of intestine without, means no peritoneum is present along with it. So this is Richter's hernia. And then there is another hernia called Litter's hernia. Talking about this hernia, very important. Now from this litter, it contains Meckel diverticulum plus may have any hernia, including lumbar hernia, ventral hernia, inguinal hernia, any type of hernia, femoral hernia, umbilical hernia, any hernia along with Meckel diverticulum is called Litter's hernia. Further, moving on, we have some other hernias which we called Madel hernia. Now, this Madel hernia, it is also called, if we invert this M, it becomes W, so it is also called hernia in W. Now, what is this hernia in W? That in this we have two abdominal loops. We have two ends of abdominal loops into the hernia with the connecting loop within the abdomen, which may be strangulated. So in this form, it forms a W-shaped hernia. This is called Madel's hernia. Okay. There is another type of hernia that is also important, that is dual hernia. Now this dual hernia is also called, I'll tell you later on. This is dual hernia, and dual hernia is also called one other name. Just give me a second. It's saddlebag hernia or pantaloon hernia. So saddlebag hernia or pantaloon hernia. So what happens in it, that we have two loops, we have two different sacs. So this is the inferior epigastric artery. We have two loops on two sides of the hernia. So this is basically dual hernia. We have two loops, two different sacs on medial and lateral side of inferior epigastric artery, and this is usually because of recurrence, that during the previous operation we have left one hernia intact that lead to another recurrence. Okay, now two very other important points, that are how to differentiate gluteal hernia from sciatic hernia. Now remember, from this G is greater sciatic foramen. So gluteal hernia, it passes from greater sciatic foramen, and this sciatic hernia, it passes from hernia, it passes through the lesser sciatic foramen. This is how you can differentiate gluteal from the sciatic hernias. So this is all about the hernias. Thank you so much. I hope you liked the video. If you did, please like, share and subscribe to my channel. Share the link of these videos with all your fellows.